The title of our study is Doomed Peripheral Intravenous Catheters. Bad outcomes are similar for emergency department and inpatient place catheters. Here are the contributing authors. The placement of peripheral intravenous catheters, or IVs as I'll refer to them, is the most common procedure in hospitals. IVs have poor survivorship regardless of where they are placed. Dwell time of these catheters is days at best. Because of these high failure rates of catheters, there is a great cost for replacing them. There's a cost to the equipment needed to place the catheters, a cost for the labor needed to place the catheters, and sometimes overlooked as a cost is patient satisfaction, as multiple IV attempts can cause significant discomfort. Traditional thought on IV placement is that the emergency department has a much greater IV failure rate compared to those placed in the inpatient setting. We wanted to study the validity of this thinking. The objective of this study was to compare differences in IV practice and survival, particularly as it relates to ED-placed catheters compared to those placed in the inpatient setting. This was a retrospective electronic medical record study at a single-center academic tertiary care referral center. Inclusion criteria for the study were hospitalized patients aged 18 or older. Exclusion criteria was for incomplete data. Primary outcomes evaluated the failure rates of catheters in the emergency department compared to those in the inpatient setting. Secondary outcomes included dwell time and failure rates of IV placement as they relate to department of placement, site of catheter placement, and the gauge of catheter. In our study, we included over 91,000 IV catheters from over 47,000 unique patient encounters. And here is our enrollment scheme. For our results for our primary outcome, we found that there was no difference in failure rate when comparing IVs placed in the emergency department and those placed in the inpatient setting, with a slightly higher failure rate in the inpatient setting that was not statistically significant. However, the failure rate is quite high for both emergency department and inpatient placed catheters. For our secondary outcome, we found the catheters placed in the emergency department had a slightly higher dwell time of 3.4 days compared to the inpatient placed catheters with a dwell time of 3.2 days. This was statistically significant. We did find, however, that the inpatient placed catheters had a higher rate of completion of therapy at 52% compared to the 47% in the emergency department. This was statistically significant. When comparing the length of stay of the patients that were admitted through the emergency department compared to those that were directly admitted, the emergency department patients had a higher length of stay at 6.5 days compared to the inpatient direct admits at 4.2 days. This was statistically significant. This is a table that stratifies IV failure by gauge and site of placement. From this table, you can see that the 20 gauge catheters have the lowest failure rate compared to the 18 and 22 gauge catheters. When comparing the site of placement, the forearm and the antecubital site had the lower failure rates when compared to the hand and the wrist. This is a table that stratifies the dwell time by gauge and site of placement. And from this table, you can see that the 20 gauge catheters had the greatest dwell time when compared to the 18 and 22 gauges, with the 18 having a slightly higher dwell time compared to the 22 gauge. When comparing the site of placement, you can see that the forearm and the antecubital placed catheters have greater dwell times when compared to the hand and the wrist. For the discussion, from the study, we found that there was no difference in failure rates when comparing the catheters placed in the emergency department and those placed in the inpatient setting, which is in contrast to traditional thoughts of catheter placement. When looking at completion of therapy, the inpatient placed catheters did have a higher rate of completion of therapy. However, patients admitted through the emergency department had on average more than 2 days longer length of stay when compared to the direct inpatient admissions, which likely accounts for the differences in completion of therapy. When choosing a site and catheter size for IV placement, our study indicates that the forearm and antecubital fossa are the preferred sites of placement as they have lower failure rates and greater dwell time. This is particularly interesting as traditional teaching states that the antecubital fossa should be avoided as it is in a joint that has significant amounts of flexion, which could increase failure rates. For the preferred gauge, 20 gauge catheters had greater dwell times and lower failure rates compared to the 18 or 20 gauge catheters, with a trend towards larger catheters having improved dwell time and lower failure rates compared to the smaller catheters. In the emergency department, we see many critically ill patients, and it is important to establish IV access quickly. In these cases, taking time to think about the most appropriate IV access methods may take more time than is available. However, this really only applies to a small percentage of patients, as most of the patients coming through the emergency department are not critically ill needing immediate IV access. For the majority of these other times when immediate IV access is not needed, a more methodical approach to access with careful thought to catheter site placement and gauge will save a patient numerous needle sticks and potentially worse complications during their hospital stay. In conclusion, peripheral intravenous catheters have a high overall failure rate regardless of where the IV is placed. From the results of our study, we recommend to place catheters in either the forearm or the intercubital fossa, and to avoid 22 gauge catheters with a preference for larger catheters, either 20 or 18 gauge. Future research should evaluate the current recommendations that state that smaller catheters should be used for catheter placement as they cause decreased rates of complications, which is in contrast to the results of our study. Thank you.